Hello, my name is Jimmy Whitworth and I'm Professor of International Public Health at the London School of Hygiene and Tropical Medicine. I'm an infectious disease epidemiologist, and so when I hear the term contagion, I immediately think of infectious diseases, particularly those that can cause epidemics. So this is particularly topical in these days of the coronavirus epidemic. The first question that comes to my mind is how can people in the community help to prevent epidemics from occurring? We can all take responsibility for our own health and that of our family. For example, making sure that we use clean water and soap for washing ourselves, for drinking water, for cooking food, and for washing up utensils. These kind of measures can help prevent diarrheal diseases such as cholera or salmonella or typhoid. Or we can avoid insect bites, particularly those from mosquitoes, which can cause diseases like dengue or malaria. Thirdly, we can avoid contact with animals if it's not necessary, particularly wild animals or bats, or avoiding eating undercooked food. And by measures like this, we can avoid diseases like Nipah virus. These are all ways in which we can reduce the possibility of infections leading to epidemics. The second question that comes to my mind is how can people in the community help to identify outbreaks when they occur? Now, unusual clusters of diseases usually occur first in the community, and they might be recognized by people in the community. And they should feel able to report these through the health system so that this reaches the technical teams. And those technical teams will then come and investigate the cause of the outbreak and whether this is something that is serious and efforts need to be made to control it. For this to work properly, there needs to be confidence in the people in the community, and they need to have trust that they're going to be listened to. On the other side, it is important that the technical team gives respect and also trusts the community in the information that they are passing on. My third question is about what can the community do to help to control an outbreak that has occurred. This is important because a technical team cannot control this themselves without the input from the community. Now, by the community reporting the outbreak very quickly in the first place, that already is a very important step. The best time to control an outbreak is now, and not to wait. If you wait, it might spread and it might get out of control. Now, the community needs to discuss with the technical team what measures need to be put in place to control the outbreak and what role they can play in being able to do this. This needs to be a partnership between the technical team and the community. So, in conclusion, outbreaks affect communities and communities always have a role for their prevention. All of us can help to prevent, to detect, or control outbreaks. Indeed, without the participation of communities, it is impossible to control outbreaks. A technical team simply cannot do it by itself. So the role and the engagement of the community is essential and is central to controlling outbreaks and preventing contagion.